During my training as a psychiatrist, a young doctor approached me after rounds. She was not crying, she was not in crisis. She said, "My life is moving forward, but I don't feel inside it." She had goals, a career ahead of her, a future that looked promising, but she felt emotionally flat, not sad, not broken, just disconnected. At the time, I didn't fully understand what she was describing. Today, I do. I'm Dr. Katia Batista, psychiatrist, and today we are talking about a psychological state that many high-functioning people experience, but rarely know how to name it. You know, the feeling that life is happening but not touching you. Psychiatry doesn't dismiss the feeling. We treat it because sometimes it's a symptom, sometimes it's an adaptation, and sometimes it's the nervous system asking for help. People often call this emptiness, but clinically it can appear as emotional flatness, lack of anticipation, or difficulty experiencing reward. Some describe it as nothing excites me. I function but I don't feel alive, or everything feels muted. This is not laziness. It's not a character flaw. Years later, a patient I call Isaac came to my consultation convinced his relationship was the problem. He described a partner who treated him well, a stable routine, no major conflict, and yet he felt distant from her in a way he couldn't explain. Not angry, not resentful, just emotionally muted. He kept repeating, "I should feel more than this." And that's clinically important because when patients say they should feel something but cannot access it, we are not longer talking about romance. We are talking about the brain's emotional regulation system, and this is where people get confused. They assume emptiness means they chose the wrong partner, the wrong job, the wrong life. Sometimes that's true, but sometimes the problem is not the environment, it's that the brain has entered survival mode. I saw the same pattern in a high performing professional. I call her Julia. Promotion after promotion, achievement after achievement, and every success fell flat within days. She didn't lack ambition, she lacked emotional reward. And from a psychiatric perspective, that distinction matters because chronic stress can blunt the brain's reward circuits. The system adapts by lowering intensity, which protects you from overload, but also steals your ability to feel satisfaction. When this happens long enough, people don't describe depression, they describe emptiness. And emptiness is often the language patients use when their brain is exhausted but hasn't collapsed yet. Inside they feel disconnected from reward. In psychiatry, this state is often linked to how the brain processes reward. Motivation is not a personality trait, it's neurobiology. Different people describe the same experience using different words. Empty, flat, disconnected, unmotivated. When this happened, I start looking beyond the story, not at personality, at brain systems. One of the key systems involved here is the brain reward system. I have been mentioning it, but let me explain you. Dopamine is often called the pleasure chemical, but clinically it plays a bigger role in motivation, reward, and anticipation. It's the signal that pulls us toward life, toward goals, connection, curiosity, and meaning. When this system is working well, we wake up with a sense of movement forward. But chronic stress, prolonged emotional stress, trauma, and certain depressive states can blunt this system. The brain adapts. It lowers emotional intensity, not because it's broken, but because it's trying to survive. I see this pattern across different conditions. In persistent depressive disorder, people may not feel deeply sad, but often describe emotional flatness and lack of motivation. In major depressive disorder, this can appear as anhedonia, the reduced ability to feel pleasure or interest. In trauma-related states, the brain may remain survival mode, limiting emotional access to prevent overwhelm. Different diagnosis, similar experience. And what matters most is not the label. What matters is understanding why life can still feel alive even when everything looks fine on the outside. What starts as protection can later feel like emptiness. Emptiness is uncomfortable. So the brain looks for something that can create a sense of intensity, connection, or distraction. Some people turn to intense relationships, not because they are dramatic, but because intensity can temporarily override emptiness. Others throw themselves into work. Productivity becomes a way to feel useful, structured, or temporarily alive. Sometimes shopping, constant stimulation, even social media. Others seek sex or even substance. From a psychiatry perspective, these are not random choices. They are attempts to activate the reward system from the outside, and they often work briefly. But the relief doesn't last because none of these address what shut the system down in the first place. They don't restore motivation. They don't reveal emotional access. They don't create meaning. They only interrupt the emptiness for a moment. And when the stimulation fades, the emptiness returns, often stronger. That's why people feel stuck in cycles of distraction rather than healing. What helps is not forcing passion. Now, when people hear this, they often ask the same question. So, how do I fix this? In psychiatry, I'm careful with that word because the goal is not to force motivation or chase intensity. The goal is to restore responsiveness. Helping the brain's reward system is not about stimulation, it's about restoration. In psychiatry, I don't ask people to feel more. I help them remove what is blocking feeling. Chronic stress, unprocessed trauma, persistent depressive states, and constant emotional pressure can all silence the reward system. The first step is reducing what keeps the brain in survival mode. The second step is gradual reactivation, not through intensity, but through meaning, human connection, predictable routines, activities that feel personally relevant, even if they don't feel exciting at first. And sometimes when emptiness is part of a depressive disorder, clinical treatment matters. Medication is not about happiness. It's about allowing the system to respond again. Not everyone who feels empty needs medication, but everyone who feels empty deserves to be evaluated. Emotional emptiness is not a failure. And I don't treat emptiness by trying to fill it with distraction, intensity, or forced motivation. I treat it by listening to what is signaling. Clinically, that means understanding what shut the system down, and this is important. Many people who feel empty already have routines. They wake up early, they work, they perform, they achieve. Their life are structured and predictable, but not all routines are regulating. Some routines are built around performance, pressure, and constant demands. Those routines keep the brain functional but not safe. What helps is not more productivity, is predictability without pressure. Routines that allow the brain to rest instead of perform. Moments without evaluation, without goals, without the need to prove anything. From a psychiatric perspective, this matters because the reward system does not reactivate when the brain is in survival mode. First, the nervous system needs safety, then motivation can return, then interest, then emotional depth. Treatment follows that understanding, sometimes through psychotherapy, sometimes through treating the medical conditions, the underlying conditions, other through rebuilding connection slowly. Like I said, not through intensity, but through consistency. Because when the brain no longer have to survive, motivation does not need to be forced. It becomes possible again. If this feeling of emptiness has been present for weeks or months, if motivation feels absent most days, if nothing seems to bring a sense of interest or emotional connection, or if you notice that your life is moving forward while you feel disconnected, this is not something you have to manage alone. Not every feeling like that means a diagnosis, but because it's often signals that the emotional system is under strain, seeking professional help is needed. It's not about labeling yourself. It's about understanding what your brain and your nervous system have been carrying and getting support before emptiness turns into suffering. If you found this video helpful, you can find more content like this here on my channel. I talk about psychiatry, mental health, and emotional patterns from a clinical and human perspective. You are welcome to subscribe, like the video, and share your thoughts in the comment. Thank you for being here.